Hi, I'm Dr. Alexis Colvin, Chief Medical Officer of the U.S. Open and an orthopedic surgeon at Mount Sinai. And I'm here with Laura Yeager, who is the Manager of Athletic Medicine at the USTA, as well as a physical therapist. So as we know, tennis is primarily a one-sided sport, and athletes tend to overload their more dominant side. So Laura has some great tips on how to correct that imbalance.
Yeah, that's a great point. So a lot of times athletes tend to go to one side every day. And so especially a tennis player, when they're serving, they're always going towards their dominant side, and it creates an imbalance in their body. So the first thing I would recommend in order to correct that is to stabilize your core. So your core acts as a crane to have a stable base to work from. So in order to train that, what I would recommend is pulling your belly button towards your back, which will help stabilize the spine. So you can add on to that little by little. So I would recommend starting about 10%, and then using that through your serve, and about 10% even as you're sitting and moving throughout the day. The next thing I would do is a bird dog maneuver. So when you're on all fours, extend the opposite arm and leg at the same time while maintaining that stable core, and you can even pull in the transverse abdominis as you do that to add a little added effect through the front and the back to stabilize. And then the last one I would recommend doing is a plank maneuver. So that helps strengthen your whole core as you're going through. So those are just 3 ideas that you could start with and then build upon that on your routine.
Great, yeah, very simple, but also very effective.